So if you've injured your knee, the most important thing is you seek like professional help. Make sure you check with your kind of primary caregiver, and this is just good general advice, and make sure you check with someone to make sure it's applicable to you. But in general, whether you've done your meniscus or you've done a ligament or you've just got some bruising or some inflammation, the way that you want to try and get it better is very, very simple. The first thing that you want to start to do is increase pain-free range of motion. Once your pain-free range of motion has started to improve, then you want to start to work on, can you straighten it more, pull it more. Then you want to work on stability, and then finally strength. So the stability of the knee, essentially, it comes from the hips and also making sure the ankle works. And then once they're working better, you want to be starting to improve better range of motion with strength and loading, making sure that your knee's staying stable. And that way you can start to get back to all the things you want to do. But start with just pain-free range of motion. That'll help get the swelling out, help get the blood flowing. Then stability, making sure your hips work, making sure your ankle work. Once that's working, then you can start to reload the tissue nice and slowly and safely so that you can begin to get back to what you want to do. You've injured your knee and you've started to do your pain-free range of motion stuff, or you're just starting to get into it. Maybe it's still a little bit too swollen. So we'll assume that you can at least stand on it. Every time that you get any swelling in your knee, it stops these muscles in here working, which means that your leg's a little bit shaky. So you're more like, that means that every step you take is a little bit more unstable, and it might be like adding a little bit of swelling. So this is a nice and simple thing you can do, even when your leg's sore, even when it's in a brace, it's called a glute med activation. So we'll assume that this is your sore leg. So you never want to hurt yourself. So find a wall, hold onto it, and all you need to do is you have your feet pointing forward and bring it back slightly. What that does is it kind of activates this muscle here called your glute med, one of the major stabilizers, and then really slowly start to move it out like that. Now, these are activations, so you're not trying to like do it really quickly. What you're trying to do is be really nice and slow and methodical and reactivate all those muscles through there. After a few, you're probably even going to start to feel a little bit of a burn, and that's perfect. Once you've done that side, as long as you can stand on the knee safely, switch to the other side, and that'll start to like get you used to standing on one leg, and also activating this muscle through here, so that every step you take, you're going to be better, stronger, and safer with those steps. So if you've injured your ankle, like you rolled it, or you had a little bit of a calf tear or something like that, or your knee, or even your hip for that matter, after you've started to work your way through your double leg stuff, you're getting your stretches and you're getting stronger, you want to start to improve the stability and the proprioception of where your foot is in space, so it's less likely for it to be re-injured. So start really simply, hold onto the wall, and you stand on one leg. So if you haven't been able to do that for a while, your foot will be really shaky. It'll start, you'll be using all the intricate muscles in your toes. You'll be working really hard, working all the muscles in your knee and also your hip. Once you feel confident with that, then you can move into just standing on one leg without holding on to anything. See, I'm a bit tired. We've been doing a few of these videos. So that's already a little bit hard. And that's going to start to get proprioception, which is your brain knowing where your foot is in ankle. So where your limbs are in space, which is really important if you're going to be running or returning to sport, because you do kind of forget. So it's an easy, simple, safe way that you can start to regain that kind of strength and confidence. And then once you've got that, imagining that you feel confident not holding on, the next thing you want to do is you want to test, can you move in the 4 directions? So you're standing on one leg and you just got to simply tap. So the reason why that's good is, if you have a look at my foot, see how this foot has to work to kind of like stabilize? And I'm having to shift my weight, having to know where I am. So once I've done that and I feel good and confident, you want to add a little bit more complexity, and you want to see if you can maintain your balance on something that's a little bit uneven, because we're going to walk on grass, we're going to walk on Stand. So this is a nice, safe way that you can start to test that stability. So you stand on the thing, and then you start doing the same process. So instantly, it's more challenging for my stabilizers, and it's going to get a much bigger workout. And I'm already starting to feel good and strong and fatigued. Perfect. So you've injured your ankle, or you've even injured your knee or your hip, and you want to get back to jumping. You've gone through your pain-free range of motion, you've started stretching, you've started getting stronger, you've got your proprioception back. Now you want to start to test it progressively and nicely and easily to get you back to what you're doing in your sport. So the first thing you want to start with is just two-legged jumping. So if your ankle's sore, if your knee's sore, you start with two legs. Just being easy on yourself, because the last thing you want to do is work really hard and then get to a point where you do something and it hurts, and then you feel like you've stepped backwards. It's normal and natural to have some things kind of happen and like a little bit of a flare up, but by being nice and slow and progressing, you'll keep them small and to a minimum, and you won't lose too much momentum. So start with your jumps. First thing you want to be able to do, two-legged. The idea is you can get it to at least 50, pain-free. And then more importantly, how do you feel the next day? It's okay to have a little bit of muscle fatigue, like you've worked it out, perfect, but you don't want to be at a point where it flares and gets really sore for a few days. If that's the case, thank God you did the jumps, because if you'd gone for a run, it would have been a lot more load through the knees and through the ankles, and it probably would have been a lot more mischief. But we'll imagine you've done your double legs, you've got yourself up to about 50, pain-free. I would suggest, start at 10, wait to see how you feel the next day, and then build from there. Then you're going to move to your single leg. And once again, you want to see if you can do 50 hops, pain-free. And then if you remember how we talk about regaining that kind of stability in different ranges of motion, you want to do the same thing when jumping. So you'll start, once again, double-legged, jumping in the 4 different directions. So that's going to make you work the different muscles, make sure you're testing and getting the ligaments to kind of grow back. Start easy, just do 1 round, or 1 to 10 rounds. See how you feel the next day. You probably are going to be a little bit muscle sore. Good, that means that you've tested the tissue, it's started to try and regrow and get stronger, but you don't want to go too hard that you can't move for a few days. So just nice and slowly. Once you can do that with 2 legs, guess what? You go to 1 leg. Same idea. Once you can do that, that's when you move to your more, starting to get a little bit more into that kind of jumping idea. And then once you can do, once again, 50 of them, with no great worry, you're pretty safe to move into like a walk, run, or a walk light jog. Just do 30 seconds of running. Don't push yourself. It's more about how you feel the next day, particularly if you've had an inflammatory type injury. You might feel really good at the time, but that's because the blood's flowing through there and you're happy to be back doing it. But it's about how you feel the next day. So if you've got an inflammatory type injury, slow it down, take your time with it, give your body the time to repair the tissue and feel better. And the easiest one that typically people get you to do is you just sit there like that, and you have a little bit of a pillow, or if you can't even flex that much, you can put a nice little towel underneath there as well. I'm trying to use things that you can find at home. So like if you go to the physio, maybe they'll give you like a ball or the chiro, but most people have a towel and a pillow. So you're trying to get straight leg activation back. So by having that little bit of a resistance, you get to tense through there and move that open through there. And then, if you can, without hurting it, you can start to bring that leg back like that. Obviously, make sure you talk to your healthcare provider, make sure that you're not doing anything you shouldn't be doing. But this is a nice, easy and simple, safe way you can start to get that. Now, if you're feeling good, then you can push into there and you can lift your leg up, raise your toes like that, and then you can come all the way back like this. If that's too hard, you can't get any range of motion like that, once again, because you got your towel, you can just simply, gently, remembering you're not going to hurt yourself, just use the towel to help you a little bit. Nice and easy and slowly. Perfect. And then you can go a little bit straighter. Just using your towel. Oh, and then the idea with these kind of range of motion stuff is it's you're not trying to force it into anything. You want to imagine it's like a rusty gate. So if you go really quickly, you break all the rust off, and that's like you got a chance of kind of re-injuring the tissue or restarting an inflammatory process. But if you're nice and slow, what happens is you start to get some fresh blood in there, start to relieve some of the swelling, and naturally you'll start to get a little bit more range of motion. So make sure you're being pain-free. If you're feeling good and strong, you can add a little bit more resistance to the towel while you push, but just keep it nice and easy. So, you've injured your knee. One of the main things you need to be able to do is get out of a chair. So, you want to start to practice that, and it's a good way that you can do it fairly safely. If you're really, really sore, you want to start from a higher position. So even just something as simple as like from a stool, you're not at 90 degrees, and then you're just coming up and doing it for reps. So you want to see if you can get up to 10 reps 3 or 4 times a day. And then once you're feeling more confident and pain-free, because that's going to start to build that up, those muscles up through there, get the blood flow, then you can move back down to your chair. And if you can, just practicing doing this. If you do 10 squats out of a chair, you will feel it. If you can, 3 sets, 3 times a day, you'll really start to strengthen both the legs. If you're feeling really ambitious and you can't quite go any lower because your range of motion won't permit in your knee, you can even see if you can do it one-legged. So you can be impressive and have your leg up, but just keeping your balance, making sure that you use that one leg. And you can do 3 sets of 10 to kind of build that up for yourself. But I would start with just that. Get really strong and easy with that range of motion. And then once you're confident, that's when you can start trying to do full range kind of squat. Now, don't hurt yourself. The purpose of it is to be able to come all the way down and then be able to come all the way back up. If you've hurt your back, this is a great way that you can start to strengthen the tissue around there without putting any kind of danger of flexion or extension in the back, provided you're being safe. Now, everyone's hips are different, everyone's knees are different. My hips naturally kind of turn out really a lot, but they don't really turn in. So each person will find it easier to go down deeper if perhaps they have their legs a little bit. Some people will be able to have their legs nice and straight, other people need to have their legs out nice like that. Just go to a length that you feel comfortable with and work your way up. And then you can go all the way down. If you're feeling unstable, you're not quite there yet, make sure you've got something to hold on to. Aim for 3 sets of 10 once a day, kind of build that up for yourself. So if you've injured your knee, or you've got like a jumper's knee, which is like patellar tendinopathy, what can happen is this muscle here doesn't work as well, it starts to shut down. It's really, really common for that muscle to not work as well. It can lead to your kneecap tracking over more to the side and it's runner's knee, and it can just lead to kind of pain and injury. So one of the easiest ways to make that muscle work is called a wolf sit. Obviously don't do anything that can hurt you. If you need to hold on to something, hold on to something and make sure you're not going to slip. But just by coming down to 90 degrees, or even here, depending on how your knee's feeling, it makes this muscle here activate. Touch through the quad itself. If you come over here, Christine, if you touch through the quad itself, it should look like kind of hard and firm. If that's not firing, all you need to do is put your hands in between your knees and just squeeze a little bit, and that'll force that to get a lot firmer. By sitting here for 30 to 90 seconds, you're also putting a lot of load through this tendon here. So if you do have jumper's knee or patellar tendinopathy, it'll start to stretch and load that tissue, get the inflammation out, and then start to send a signal for that to start to improve. So it's just a really good activation exercise. So whether or not if you've got knee pain when you're running, if you've got patellar tendinopathy, if you've got any kind of swelling in the knee, this is really good thing that you can do before you do any other exercise that'll help your knee function better, help improve stability, and also reduce pain. If you're looking to get stronger, coming down to 90, holding it for 30 to 90 seconds, and then giving yourself a little bit of a break will make the muscles fire, get the quads working, and also help strengthen your tendons. One of the things that makes it really hard to do is to actually maintain control going downstairs. And that's really important, because if you're going downstairs, which happens a lot in our day-to-day world, if you're falling into it because you've lost control, then you're really increasing your risk of injury, and it's something that you can start working on really slowly and safely, and it has a lot of really great effects. So it's called a Jefferson step. I assume it was invented by some bloke called Jefferson. But the way that you start to keep it nice and easy, let's say you've really injured your knee, is you can hold on to something, you have your injured knee down, and then all you got to do is just step forward like that. See how that makes my knee bend? I'm working on my stability through here, makes my ankle bend, and then I'm coming back. When you're feeling better with that, you see if you go further, see I'm bending my knee more, I'm actually starting to get control when I'm going up and down stairs. Once I'm confident, I'll let go of the rail, and that's going to make me use all of my stabilizers in my hip, in my ankle. You're going to start getting some really good kind of tension through there. Once you're confident with that, and don't neglect the other leg, make sure you do both, that's when you can move to the step. So if you have a look at my ankle, if I go down the step, depending on how much range of motion I have in my ankles, when I come down, I have to lift that. So that's actually a really complicated movement. So you need to have ankle mobility, strength through here, control in the knee, and stability in the hip. And we use it all the time. So you're on your step, and all you got to try and do is come down and touch. And then you're looking to come back up nice and slowly. And then come down and touch. Once you're feeling really confident, you let go of your grip. And then, once again, that's really working your stabilizers. Build yourself up nice and slowly. Aim to do like 3 sets of 10. Obviously both legs. Now this can take some time to develop, but it's really worth doing because we go up and down steps a lot. And if you're fatigued and you don't have control going down that step, that's when a lot of people will re-injure themselves. And you can do it pretty easy if you've got a step, super easy. If you don't have a step, all you need to be able to do is just go a little bit further and just see your leg come off the ground. Okay. So you've injured your knee or your back, or you're just basically trying to get some strength back into your body. There's a few simple bridges that you can do. So the first bridge that I'll show you is called a hamstring bridge. And what it does is it makes your hemis work really well. So if your feet are close, you'll actually work your glutes, which I'll show you in a tick. But what we're after is to see if we can get the hamstrings to fire. So to do that, all you need to do is just put your legs a little bit further out. And then when you come up, I'll feel the pressure through my hamstrings. I'm coming all the way up. I'll still get some glute activation, but a lot of that load is I'm feeling it through my hammies, and you should feel them kind of really fire up. If you've got yourself a hamstring tendinopathy, or you've done a little bit of a tear in your hammies, or they're just weak from a knee injury, this is a really, really great place to start. Obviously, you're starting with 2 legs, and just go to where you feel you can. If you want to make it easier, you can bring your legs a little bit closer, because that makes your glutes activate more. If you want to make it harder, you can take it further out to really work on like lifting that up like that. So these ones, you want to do 3 sets of 10, at least once a day. Start to kind of build that up, and then you can move into some more muscle exercises. If you're feeling really good and confident with that, then you can move to 1 leg. Same idea. And I'm feeling quite a little burn through there. I shouldn't have gone to the gym this morning. Very good. So once you've done your hamstrings, then you can move to your glutes. So you're going to move your feet closer together, and if it helps, you can put your hands on your glutes just to make sure that they're firing. And you want to be nice and slow and deliberate, making sure you feel them kind of burn as you come up, getting your back off the ground. This is a good place to start even if you've hurt your back, as long as you start really slowly, because I'm not putting any flexion into my lower spine, particularly if I'm being careful. And then if I'm feeling good and confident with that, I'll move to 1 leg. And that's obviously working that side. 3 sets of 10, at least once a day. You start to get them working better. far better. So you've injured your knee, or you just wanted to get some strength back and some flexibility into your hip flexors and your glutes. A really good place to start is what's called an APG split squat, made famous by the kind of knees over toes guy on social media. Thank you very much. And it's good because you can do it on, find something stable like some stairs, rail would be great. And let's say you start with your injured leg, you put that up like that, holding on. All I'm doing is just going to pain-free range of motion. So that will help me use my quad, get some strength and some range of motion, and I'm being real safe. Like, I've got this, I've got it really controlled. But if you have a look at this leg, that is also making my hip flexor stretch, my slower stretch under load. So it's strengthening and lengthening that. Plus, if you have a look on this leg, I'm getting to use my glute. So it's really good. You get controlled and stable pain-free range of motion. So you're getting all the fluid out of your knee, you're strengthening your quads, you're reactivating your glutes, and you're stretching and loading your psoas. And it's, as you get more confident with that, you can make it harder by just simply going down a step. The idea is you get better and better at going into those positions. So you start holding, you want to aim for 5 sets of 5, obviously both legs. But start really slow, start up nice and high, and walk your way down. And the goal, I'm not good enough room anymore, but the goal is to be able to come all the way down and then all the way up in those 5 sets of 5s. Then you can start adding some weight to that if you'd like. But by doing this, I'm really helping open that up. I'm helping get fluid out of there. I'm strengthening the tissue, and I'm also developing control and balance. So it's really safe and easy. If you've got a sore back, you've injured your knee, you've injured your hip or even your ankles, it's really good. Works most of the lower body, and you can progress it really safely and easily. It's called a good morning stretch. Essentially, all you need to do, take your feet out as far as you feel comfortable. You're already going to start to feel a stretch through there, and then all you've got to do is lean forward. And then you can walk your way out. Start to go a little bit deeper, like that. This might be a little bit intense for you to start with, so you can always start with it on your knees, but we'll do another stretch that also helps with that later. But just coming through and opening those hips up like that. Hold for 30 to 90 seconds. They've done some really good research that all you need to do is essentially hold a pose, stretch for up to 5 minutes a week. So it kind of accumulates and you'll start to see some progress. But if you're able to do it on your legs, by coming down like that, you're loading the tissue with some weight. So you're starting to stretch it while starting to strengthen it. And it can be a really nice, easy thing for you to do to start to reload and strengthen your abductors, plus start to get some more range of motion in it. So if you've injured your knee or your quads are tight or your hemis are tight, there's some great acupressure points that you can use to help reduce the pain. So if this is sore or it's swollen and you don't want to injure yourself, then the first kind of points you can start with just by massaging the opposite shoulder. So this will start from a Chinese medicine point of view to release and get some blood flow through the tissue. So my suggestion is you come through, you massage through there, and then if you work your way down your opposite bicep, this in turn starts to relax the quads, not the quads, sorry, the hemis. And in Chinese medicine we talk about, once again, the interconnectedness of the body. So there's some great traditional points that we use in the hand that'll help activate the muscles in the hip, which will protect the knee, but also get the quads to fire better, hemis to fire better, and the swelling underneath the knee better. So always nice and gently, but on the opposite hand, starting in between these bones, working our way through. You're probably going to find a few tender spots. If you do, just stop for 30 to 90 seconds and just hold. As you hold it, you should actually start to feel that release, and then move on, coming all the way through. There is the classic point for pain throughout the whole body in Chinese medicine, large intestine 4, that you can just massage here. Traditionally, we don't use this if you're pregnant, so if you're pregnant or looking to get pregnant, just don't do it. Now, so you've started with that, so there should be nice blood flow through there, and now you want to get in and massage some of the spots around the knee itself. once again, if you've done a tear or you've damaged some ligaments or anything like that, good rule of thumb is make sure you check with your doctor or like your primary care, so you're not doing any kind of mischief to yourself. But just by massaging, I'll bring my pants up. So you've got the tendon that comes through here, but just by getting in and massaging the tendon, and then moving to what Chinese medicine calls the knee eye, which is below the kneecap but above that bone there, we're trying to stimulate some blood flow into the capsule itself. And if there is any mischief in there, by massaging it, it'll break up any kind of scar tissue, get some fresh blood, and then you're going to come around to the side. These are where like your MCL, like your medial collateral ligament is, on the opposite side MCL. So obviously if you have an injury there, make sure you're being gentle and you're outside of that kind of time when you want to let them heal. Talk to your carer about a minimum 2 weeks, sometimes longer. But gentle massage through there to help some blood flow. And then you're going to do the same underneath the knee. The main muscles that are going to get sore and tight if you have any knee mischief is this muscle called vastus medialis, or the VMO. It shuts down and can lose some muscle size quite quickly if there is some swelling in there. So right in that teardrop that you're meant to have, there's a traditional acupuncture point where if you massage, it should help get some fresh blood through there, release the muscle, help it kind of activate in the future so it feels better. But if there is an injury, like I said, this one shuts down, but usually the opposite one goes really tight. So that same point, but on the other side, just above the knee, you can use that and massage down a whole line through there, finding any of the tight sore bits. If you do, you can stop and hold for 30 to 90 seconds. You should feel it release underneath you, and then coming all the way up into the... You're going to feel a lot better with that. If your hemis are tight, you know, you can get a ball into there, or you could like roll it and things like that. But let's imagine you don't have any of those things. You're just sitting on the floor or on the lounge. You can just work your way through the thigh. Nice. Coming all the way up, finding those tight bits of the muscle belly. You don't need to go bananas, but just by massaging it, you're going to be stimulating some blood flow. It also helps reduce some pain as well. And if you can do that every night, you're going to help facilitate some healing. If you've done some mischief to your abductors, same idea. Start on the side and just working your way through. Coming all the way up. And that'll do it. That's pretty much, you've relaxed the whole neck, whole quad. You've got some blood flow through the whole joint. You've covered most of the tendons, and you'll feel good doing it.